Good afternoon and welcome to our media briefing. I hope everyone made it through what was obviously a very hot weekend. Before we go into the updates and discuss the watch list, I want to touch on a couple of other things that are also going on. We've all felt the ongoing heat wave, and we're not done with it yet, obviously. The National Weather Service has issued an excessive heat warning for San Diego County valleys, mountains, and deserts through Thursday at 10 p.m. Dangerously hot conditions with high temperatures of 98 to 118 degrees are expected. We want to remind the public that our cool zone sites, mostly located in the hottest areas of the county, will be available to help older adults and others. Due to COVID-19, safety measures will be in place to protect the health of cool zone visitors and staff. Anyone entering a county cool zone will have their temperatures taken. All visitors and staff must also wear facial coverings and practice social distancing. Time limits may be in place due to limited capacity. There will be a select number of cool zone locations to the public, so please check location updates and additional information. To check, visit coolzones.org or call our Aging and Independent Services call center at 800-339-4661. That's 800-339-4661. This morning, many of us also got a sharp reminder that we live in earthquake country, as many felt an earthquake that was centered in Baja California. This is a good opportunity to remind everyone, if you haven't done so, to please have an emergency preparedness plan. Our County Office of Emergency Services can show you how to make a preparedness plan and create and build an emergency supply kit. You can also download our emergency preparedness app and sign up your cell phone for Alert San Diego reverse 911 calls. All of this information can be found at readysandiego.org. Coronavirus is an ongoing emergency, but we can't forget that San Diego is always vulnerable to earthquakes, wildfires, and other disasters. So please get prepared. Thank you, and let's move on to the updates, starting with Supervisor Fletcher.
Thank you, Chairman Cox, and good afternoon. Today is the 200th day our Emergency Operations Center has been activated in response to the COVID-19 pandemic. And I would like to take a moment to thank all of the individuals who for 200 consecutive days, 7 days a week, have been working tirelessly to try and guide the county's response. Not just our internal staff here at the county, but all of our partners, those in the healthcare system, the hospitals, the doctors, our partners in local government and other agencies who have come together to deal with a really unprecedented and very difficult situation. We continue to learn, we continue to adapt, and while we have not gotten everything right, we are striving to serve the public as best we can. And so I want to say a special thank you to everyone who has worked so tirelessly over the last 200 days, and everyone who recognizes that we still have a ways to go and have accepted that we have to continue to be vigilant, we have to continue to be very mindful, and we have to continue to learn and adapt and do everything we can to save lives, protect the integrity of our healthcare system, and restore our economy. On that front, we have seen good news in the recent days with our numbers continuing to decline. It is no surprise that after the tightenings and restrictions were put in place on the entities that were causing the most number of cases and outbreaks, that we begin to see a decline. Today, the governor alluded to San Diego being one of the counties that is about to come off perhaps tomorrow. There's been some questions about that, given our cases have been lower for a few days. The state has been reconciling their backlog and placing those in, and so we do expect probably tomorrow we will officially come off the state monitoring list, which is encouraging, but it is a moment to remind ourselves that the goal is not just to get below the list, the goal is to stay below the list, which means that as soon as we come off the monitoring list, we have to have the same vigilance, the same focus, and the same effort to continue to keep our case count low. What is most damaging and most concerning is the constant seesaw back and forth, and we would like to see moving forward a smooth, steady, and even recovery. We have asked the state for guidance on what they think the policy will be, the process will be for potentially reopening some of the entities that faced additional restrictions when we went above They are working on that and said at some point in the future they will share that with us. But for now, if we come off the state monitoring list, the only substantive impact would be on schools. Once we are off, if we remain off for 14 consecutive days, then all schools K through 12 would be able to open at their own discretion based on filling out and complying with the safe guidance reopening plans that have been provided. Between now and then, we will continue to process waiver applications for elementary schools that have been submitted, and we will continue to work on that. But again, getting off the state monitoring list is not a finish line. It is a midpoint in a marathon, and so we have to continue to utilize face coverings, avoid large indoor settings, physically distance from non-household members, hand wash, and all of the things that we've done over the past month to really change the trajectory of our cases here in San Diego County. And if we do that, that gives us the best chance at a smooth and steady recovery moving forward. With that, let's jump into our results and numbers for today, beginning with our T3. Testing continues to be very strong. You see a 7-day average here of 7,890. And again, our focus in our public health labs is to rapidly turn around our test results. We're doing a very good job of turning those around, as are the hospital systems. And so we will continue to strive to make sure we can do that. Our 14-day percentage of positive of new cases is 4.2. Again, down considerably from where we were, but we would obviously, the lower it goes, the better. Contact tracing, case investigations, contact tracing are doing great. You see total case investigations performed closing in on 40,000 there, and then the treatment numbers in the right-hand side. For today's totals, we're reporting 282 new positive cases out of 6,377 being reported today. Again, some of those are batching. You see represented by the asterisk, but that's a 4% percentage of positive. The purple line there representing the 14-day rolling average, which again you see generally trending down, which is encouraging. Hospitalization census, again, this continues to, you can see the trends there over time, which continue to be very encouraging. ICU utilization down to 97. Total COVID-related hospitalizations at 271. Again, on the next slide here, you can see our COVID numbers versus the total hospital population. Again, those COVID numbers you can see coming down pretty significantly from where they were, not quite in half, but close to that. And then you see the total system utilization well below the 80% bed capacity where we were. And then the final chart is our ICU system capacity, our COVID and non-COVID. And again, holding steady there at 62%, 434, which gives us plenty of room in our ICU system for capacity that may be needed. That concludes my section of the report. I'll now turn it over to Dr. Wooten for a public health officer's update.
Thank you, Supervisor Fletcher, and welcome everyone to today's Monday briefing. As stated, today is exciting on two fronts. First, this is day 200 in our journey through this COVID-19 pandemic. And second, we are anticipating that after today, we will be off the state's monitoring list. So today's global, national, and state statistics are based on data from the Johns Hopkins dashboard that was obtained today at noon. Today's local statistics for San Diego County are from reports that were made to our epidemiology program up through 11:59 last evening. Today, there is a total of 34,960 cases, which is 282 more cases than yesterday, which is a decrease in new cases since yesterday's report of 334 cases. The overall total number of cases includes 626 deaths. There have been no new deaths reported since yesterday. And the age range of all of our cases remains the same, from 3 months of age to 102 years of age. The age range from 20 to 49 years of age makes up the majority of all cases at 59%, or 20,574 cases. 51% of all cases are female and 49% are male, and there are leaving 113 individuals that have no gender information provided or identified. 8% or 2,868 of our cases have been hospitalized, and of that number, 716 have been admitted to the ICU, and this is 2% of the total number of cases and 25% of the total number of those hospitalized. Going into the next slide as it relates to hospitalizations. Of the 2,868 hospitalizations, individuals 50 years of age and older represent the majority of these cases, 2,030 or 71% of individuals 50 years of age and older have been hospitalized. Males represent the majority at 1,553 or 54%. Latinos and or Hispanics represent the majority at 1,649 or 62%. In the next slide, talking about total deaths at 626, this represents 1.8% of the total number of cases, and this is also the county's case fatality ratio, which is the number of deaths divided by the total number of cases. Now, of the deaths, 271 or 43% were female, 355 or 57% were male, and 599 or 96% of the total deaths had underlying medical conditions. 27 had no underlying medical conditions, and that represents 4% of those individuals reported as dying. And we, as always, want to extend our sincerest sympathies to the families and friends of those individuals who have experienced the loss of their family member or friend as a result of COVID-19. Now, next, I'd like to bring attention to the summary of all of our outbreaks as conveyed on this slide. Since the beginning of the pandemic, 355 total outbreaks have been or have occurred in 3 categories: skilled nursing facilities, other congregate settings, and community settings. Community settings is the category community settings is one of our county's 13 triggers that is elevated, and we will discuss this in detail shortly. Of the 355 outbreaks, 233 or 66% are now closed or inactive, meaning no new cases have occurred in the past 14 days or longer. This leaves 122 or 34%, just over a third of the 355 outbreaks that are active outbreaks. Of these, 34 or 28% of the active outbreaks are in our county's skilled nursing facilities, and we have 86 in San Diego County. In total, there have been 783 residents and 513 staff members with laboratory-confirmed COVID-19, including 153 deaths. 30 or 25% of the 122 active outbreaks are in non-skilled nursing facilities or other congregate settings such as jails or detention facilities. In this category, there have been 712 residents and 556 staff members reported, which includes 101 deaths. And lastly, 58 or 48% of the 122 active outbreaks currently existing are in community setting locations. And since March, the total community outbreaks have produced 1,447 laboratory confirmed cases, including a total of 12 deaths. Now, before moving to the discussion of the triggers, I'd like to just take a few minutes to give and provide information about testing. Since the CDC and the state have both updated their testing guidance, their recommended priority categories or tiers are broad. Recognizing the challenges that presented for organizations to operationalize, in particular those who face limits in their testing, supplies, or capacity, we worked with our healthcare partners throughout the region to finalize our local priority levels. The updated priority testing tiers consist of 5 tiers, 4 with specific priority for symptomatic settings or individuals in the first 2, and then asymptomatic groups in the second 2, with the 5th tier reserved for public health surveillance, given adequate resources are available. And we will go and discuss the new prioritization in detail on Wednesday. And just as a reminder, our KHAN will be going out today that also provides that detail. So as you know, the county has opened several walk-up testing sites throughout the region. One example of that effort is the site that opened at the border crossing last week. And over the last 3 days since this testing site has opened, more than 310 tests were collected. 310 tests were collected. Our testing numbers only reflect those tests that are residents of San Diego, and results for residents of Mexico, if they exist, are reported to our partners in Mexico. Now, moving on, let's review our 13 triggers for San Diego County. On the next slide. And these triggers help to determine what actions will be taken in modifying the health officer's orders. Trigger number 1, we stated last week that we were moving towards being off the state's county monitoring list, and we would find out over the weekend exactly where we are as the state reconciled backlogged testing. And indeed, I did receive a phone call on Sunday from the interim state health officer, Dr. Erica Pan, and was informed that our new first date below 100 per 100,000 population was Saturday. If we can go to the next slide. And we'll come back and talk about community setting outbreaks. So as you can see here, Saturday was August 15th. We were at 94.7, Sunday 91.9, and today, Monday, August 17th, we are at 89.9. So we anticipate, as was announced by the governor today, that we would come off the list tomorrow. Now, what I'd like to share with you is just a rehash of the slides we showed last Wednesday. Next slide. Yes. So again, this is the process for exiting the state's county monitoring list. Day 1, 2, 3, non-elevated data. Today is our day 3. Tomorrow, we officially come off the list, and beginning tomorrow, for the next 14 days, if we remain off the list on the 15th day, our San Diego County schools should be able to open, and this is specifically for K through 12, for in-person education and learning. In the next slide, this just shows the actual dates so that everyone is clear on when our new dates for the 14-day period after coming off the monitoring list actually is. And that would mean that after August 31st, which is September 1st and a Tuesday, San Diego County schools should be able to open K through 12 for in-person education. Again, this is contingent on having 14 days where our case rate is less than 100 per 100,000 population. Okay, moving to the next slide, we're going to be talking about our community setting outbreaks. And this is actually, of the 13 triggers currently being followed, this is the only one that is now abnormal. And this slide shows all of our active and inactive community setting outbreaks since March 25th. Is there a next slide? And this slide shows of the past 7 days, which is the actual trigger. We have 21 outbreaks representing 96 cases, and we have those outbreaks stratified by the various settings. And just a point of clarification for grocery, where there are 3 outbreaks identified, we will be splitting that into a grocery/retail as we have one of those reported today. And actually, if you can go to the next slide, that shows that for the past 7 days, we have 2 new outbreaks as reported today, 1 in a grocery and 1 in a grocery retail setting. In the next slide, I just want to leave you in closing. I just cannot say enough that getting through this pandemic requires that we all do our part and play our role. The majority of San Diegans are doing just that. And I'd like to give kudos to those businesses that have been responsive and innovative to implement the state's orders, which in turn translates to our local health officers' orders. Continuing these efforts will require that everyone adheres to the following behaviors. The first is washing your hands frequently and promoting sanitation practices in your businesses particularly. Staying 6 feet apart from others unless these individuals are household members, wearing a facial covering, avoiding crowds, and staying home if you're sick. Thank you so much again. Now please welcome back to the podium Chairman Greg Cox. Thank you.
We'll go straight to the questions.
Hi, thank you for taking my question. I want to ask you about Boulevard Fitness. I think you're all aware that this gym has stayed open for the past month despite the multiple orders to close their indoor operations. San Diego Police Department says they gave the owner a citation last Tuesday, but we've seen photos and videos on Instagram of some gym members working out inside still even today. So first, can you explain what the penalties are that this gym owner is facing, financial or otherwise? Second, is there a next level of enforcement that would maybe give the gym owner an extra push to actually shut down and comply with the health order, since nothing has worked so far? And third, while it's true, of course, that most businesses are complying with the health order, do you think the county has been fast enough and strict enough in cracking down on these very few outliers?
Okay, Supervisor Fletcher is going to respond.
Thank you, Andrew, for the question. The general steps are when we have a complaint of an egregious violator, we can send some of our public health code enforcement folks out working with the local jurisdiction, see if we can gain compliance. If that doesn't work, then we can issue either a cease and desist or a public health order and closure, and then the next step would be a citation for a violation, and they can be fined $1,000 a day every day that they are in noncompliance. That really is the extent of the tools and mechanisms under the public health orders. Some local jurisdictions may have additional tools that they can utilize surrounding business licensing or other types of things, but that's at the discretion of the local health agency. In terms of the speed at which we've moved, I think that's why you've seen such effort in the recent time to increase our staffing, increase our compliance teams, refine our hotline process in order to get information, because we don't think we have been going fast enough to get to those, and that's the problem we've been trying to address in the course of the last 3 weeks. And so now, as those compliance teams are better staffed and we have the procedures worked out with most of the local jurisdictions, the hope is we can move much more swiftly on those egregious, willful, blatant violators. But again, there are some limits about what tools the county has from a public health standpoint in terms of enforcement. But we do certainly hope folks would comply. If not, we hope that initial visit would gain compliance. If not, we hope the issuance of a public health closure notice would gain compliance. In almost every instance, minus this one, that has generally worked. And then there's the option to have them cited by law enforcement, and then either the district attorney or the city attorney charging them for those offenses.
Really quick follow-up. So if it's $1,000 a day for each day that the gym stays open, how are you verifying that how many days that is actually the case? And when does that bill come due?
Well, when it comes due is somewhat dependent upon the city attorney in the city of San Diego or the district attorney for every other jurisdiction for moving forward with the court proceedings on that misdemeanor charge. And the way it would be verified would be law enforcement going back on a regular basis to continue to recite them. And so we'll continue to work with the local law enforcement agencies in each jurisdiction. Again, this is a unique circumstance and situation. The majority of folks, the overwhelming majority of folks have come into compliance at some point along that process. But we'll continue to do everything possible we can. We'll continue to work with local jurisdictions to do everything possible they can, and then continue to analyze or look for what additional tools might become available in the hopes of gaining compliance.
So, sorry to keep on following up here, but so the one citation SCPD issued, that one will be $1,000 unless they go back and cite them each single day that they're still open. It'll just be that $1,000 and that's it?
Yeah, I believe that they would need to go back and recite them. And in our discussions with law enforcement, that was the intent, that when they cited them, then they would return visit to continue to issue citations.
Okay, thank you.
Thank you.
Okay, next question.
Next is Bridget Niso with NBC7.
Good afternoon. Many expected San Diego County could be off the watch list today, but you've clarified that technically, based on backlog, that our days under 100 cases actually began on Saturday. Given that, working with the State Health Department, can you describe the analysis to determine what types of businesses or places of worship can eventually reopen so they can have people indoors? What does that look like?
Okay, Dr. Wooten's going to respond.
For the last question, I stated that our case rates, the impact is for schools K through 12. For other businesses, that guidance and direction would come from the state, and the state is looking at what they are going to do, but there are no guidance at this point in time. So again, we will just have to be patient and wait for the state to provide that direction. Thank you.
Can I follow up? Do you anticipate, I know that the governor mentioned it today, that they were working with state health on that. Do you anticipate a timetable?
I can't give you a timetable. We, again, just need to be patient and wait for the guidance to come out from the state.
Thank you.
Okay, we'll go to the next question.
Next is Colleen Shelby with the Los Angeles Times.
Hi, thanks for taking my question. I'm wondering on day 200 if there's any lessons learned from the past, several weeks even, of what to do to prevent a resurgence in cases and how to prevent going backwards and being placed back on the watch list once you're officially off. And I know, just a quick follow-up to that question about the guidance. At this point, like over the past couple of weeks, have you received any further guidance about what the state will need to do to remain off, or what's going to happen going forward, or are you still kind of just waiting?
In reference to the last part of that question, I happened to be on a conference call this morning with Dr. Galley and asked that very specific question in regards, we know what's going to happen if we're off for a total of 17 days off the watch list or off the monitor list. It's good news for K through 12 schools, but it doesn't apply to anybody else. And Dr. Galley said that they are working on that guidance. It's not quite ready yet, but he thought it would be coming out fairly soon. So I know Supervisor Fletcher's got some additional response on the first part of the question.
Thank you. I think one of the biggest takeaways is just the challenge we face in terms of accepting that until we get a vaccine or therapeutic treatment, we're going to be in a daily state of monitoring our cases, evaluating our numbers, utilizing face coverings, avoiding indoor gatherings. And I think initially when we came out, the entire community came together and we didn't flatten the curve. We destroyed the curve. And then as we started the reopening, I think there was a sense among some that, hey, we're through this and we're out of the woods and everything's okay. And I think that lack of focus and vigilance, in addition to a large number of things opening very quickly, contributed to the significant spread. And it wasn't just us. I mean, the entire country went through similar episodes. And I think now as we come out of it, I think we have to be very mindful that as we come off of the state monitoring list, it can't be a sense of we're off the list, everything is fine. It has to be, we did a good job getting our case count down, now let's keep it down. And so the acceptance of what we've talked about going all the way back to April and May with the messaging around adapting to a new normal, that for the foreseeable future, we're going to live in a constant state of monitoring our spread and trying to slow this. Now, we can do that and get most sections of our economy up and running. we can do that and have a fair shot at trying to get some of our schools safely reopened. We can do that in terms of getting large sections of what we enjoy in our life back. But until we get to that vaccine or therapeutic treatment or some combination of one or the other, we're going to be in this state. And so I think as we hit the 200-day mark today, it's a day to reflect of how far we've come, but a recognition that unfortunately in a global public health pandemic, this is going to be the state we're in for a while. And so I think, avoiding the mindset of we crossed a finish line to reopen or we crossed a finish line to get off the monitoring list, instead of we're settling into a slow, steady marathon type pace as we see this through, is certainly one of the most important things. And then the last thing I think is that the debate around reopenings often I think has been pitched in the wrong way. There's no one that I'm aware of anywhere that doesn't want businesses to be open. But if you want business to be open or you want to save the lives of the most vulnerable and protect the integrity of our healthcare system, we do the exact same thing to accomplish both, and that is slow the spread. And so it's the hope moving forward we can find some community unity behind the effort to slow the spread, both to save lives and to save jobs, and figure out how we can move forward in that spirit.
Okay, next question.
Next caller is Brandon Lewis, CBS 8.
Thank you. I just wanted to start first with a clarification because CDPH updated its site this afternoon to show that San Diego is on day 2, not day 3. So I just want to make sure that it's possible we could come off tomorrow, not that tomorrow is day 3.
Okay, here's Dr. Wooten.
Well, thank you for the opportunity to clarify once again. The governor clearly said that today they could be reporting tomorrow that San Diego is off the list if we continue to be below 100 cases per 100,000 population. So yesterday was day 2, today is day 3. If that indeed is the case today and the results that we have show that, then tomorrow we would come off the list. I heard the governor say that, so it might be useful for you to go back and re-listen to that briefing. Thanks.
Thank you, Dr. Wooten. Yes, I heard the governor as well. It was the CDPH website that I was referring to. But I also wanted to ask the supervisors a question. For Supervisor Cox, I want to ask about the letter that you co-signed to Governor Newsom asking for guidance on reopening businesses. How quickly would you want that guidance back? And if it does come through fairly soon, as Dr. Galley told you, given that schools have to wait 14 days, do you want industries to wait the 14 days as well, perhaps? And would you like all of them to be reopened right away? Because you listed quite a few number of industries in that letter. And then for Supervisor Fletcher, I know you've historically voted against some of these requests in the past when they've come up to the full board. So I wonder what you thought of Supervisor Cox's letter and this push to reopen.
Yeah, let me clarify that the letter was from myself as one supervisor and from Mayor Faulkner. And I'm certainly not trying to give guidance to the state of California. I think it's really more of a question of being able to tell businesses that are out there that are keeping, calling and asking all of the elected officials, when are they going to be able to open back up? I don't know what the answer to that is. I'm certainly going to leave it in the decision making of the public health director for San Diego County and for the state of California. So I'm not advocating anything in particular other than it would be helpful for everybody if we could get some good solid guidance that businesses will have an opportunity to know whether, there's an opportunity several weeks down the line or whether it's several months down the line. So I hope that Dr. Galley can, and the governor can come back in a reasonable period of time. And I got the indications, hopefully maybe to be sometime latter part of this week, to give some guidance so that the businesses will have an answer to that question that they keep raising. Supervisor Fletcher?
Yeah, thank you for the question. Given we have not yet officially come off the state monitoring list, given the state has not yet issued guidance, nor have we yet considered the guidance that hasn't been issued, I couldn't really comment on if I would support something that would be a hypothetical on top of a hypothetical on top of a hypothetical. So I'm sure when we get to that point, I'll have an opinion on my take as I have in the past, but I can't really comment on that at this point. I will say, though, we saw a significant increase in cases. Our numbers were going up fairly significantly. The state ordered some restrictions to put in place, and after those restrictions were put in place, the number of cases came down. And so I think that we need to be cautious as we move forward, that if we were to immediately go back to the posture when the cases went up, it would seem to be incredibly likely that the number of cases could potentially go back up. And so the goal is to get off the monitoring list. Now, are there some of those entities that our public health officials may say, based on the data, based on what we've seen, we think that those are lower risk entities and those could safely reopen without contributing to our case count? I think that that is entirely possible. And so based again on the data, the science, the advice of public health officials, when we get to that point, sure, we could almost certainly find some that we feel comfortable that we could reopen. But I don't think it would make sense to just immediately snap back to where we were. But again, we'll have to wait and see what happens as we move forward.
Thank you,
Next question.
Next question is Taryn Minto with KPBS.
Yeah, hi, sorry, I would like to further clarify something for my first question. The county reported the state calculated case rate showed day 3 that we were below the threshold was on Friday, but we're talking about how Saturday was the first day according to the state. Can you clarify why that is? Is that just because the state was counting more backlog cases that the county didn't have that information? Just quickly clarify why that is.
Dr. Wooten's going to respond.
And I do have follow-up.
Yes. So again, as I have shared today, is that I shared with all of you on Wednesday that the state would be looking at their data and going back and reanalyzing the case rates for that week. And again, I was called on yesterday. The state indeed did do that. And the interim health officer informed me that our first day was cited as Saturday, even though before we were telling you that our numbers were below 100. So again, while we were utilizing the data that we had at the time, so that's why as of Wednesday, we were reporting our cases less than 100. But again, the state went back, reassigned the backlog tests to the days that they came in, and recalculated the case rates. It might sound complicated, but that's what happened. That's what we told you was going to happen. And as of a result of that happening, we now know what our status is as a result of the reanalyzation of the backlog tests that came in. Does that clarify it for you?
Yes, it does. Thank
Okay.
you.
And
my follow-up.
sure, go on.
Yeah, my follow-up question is just to you to ask. I know we're waiting to hear from the state guidance on reopening, but you are a public health officer, and even if the state permits some things, you still get to make decisions. What kind of reopening would you like to see? Where would you start? How would you roll it out?
Well, I'm not going to go into details on that. We know that there are some businesses that are low risk or lower risk and some that are higher risk. So what will be the guidance that we will get from the state will come as a result of collaborating and getting feedback from the health officers across the state. So until that happens, again, my constant statement is that we just have to be patient and to get the guidance from the state that can be implemented across the entire state. And I also wanted to go back to the question of an individual when you talked about the state's monitoring list. They may not have updated it, but at the close of business today, it should be. And again, directly called by the health officer yesterday. There was a phone call this morning. So unless we get additional information that some new data reveals something else, we do expect that we will be off the monitoring list as of tomorrow, and then we will begin countdown of the next 14 days so that K through 12 schools can open. Thank you.
Thank you, Dr. Wooten.
Okay, next question.
Next caller is Hunter Sowards with KUSI.
Hi, Hi there. Thanks so much for taking my questions. My first one, can you step us through what the next 14 days will look like as far as enforcement goes? Can we expect to see an increase simply because of what we're under right now, how important it is? And then my second question, when it comes to this waiting period, we obviously know that there's not a timeline, but it has to be frustrating for these businesses. Supervisor Cox touched on this with the letter that he sent to the governor. So I'm wondering if you could just kind of speak to those businesses who are listening. I mean, there's so many people watching on the live stream right now who are kind of feel like they're in limbo and are now being told to wait some more until the state comes out with their additional guidance on as far as what happens for businesses. If somebody could just kind of give them words of encouragement or some clarity there.
Well, I think the last part of your comments there, I think, is what I'm really focusing on is clarity. I think, we know what the rules are in regards to schools. Businesses, I think, by and large, are complying with our public health orders and doing the right thing. We do have some that are not, and those we are dealing with. I think this last week, as I recall, I think we had about 600 calls come into the complaint line. Those are being followed up. We've got good cooperation from all 18 cities. 9 of those cities are under the jurisdiction of the county for law enforcement, and so we'll be working on enforcement in those 9 cities. The other 9 cities have worked up various means of responding to those complaints or calls in their jurisdictions. And I think at this point, we feel confident that we've got a good system in place to follow up on complaints and hopefully to gain greater compliance. And again, most of the businesses are complying very effectively. My hope is that by the end of this week, we'll have some guidance from the state in regards to what the opportunities may or may not be for businesses. As Supervisor Fletcher said, I think there's some businesses that could probably be modified, and Dr. Wooten made reference to this, where maybe they can greater accommodate a number of people still with a proper social distancing, and businesses I think are anxious to find out what the next set of guidelines are going to be. And so more than anything else, I think we just want information so everybody has the same information and they can plan accordingly. Does that answer your question?
Yes, I think so. And then I just have a follow-up for Dr. Wooten. If she could just go over, re-explain how the positive cases are being counted and attributed each day as far as this backlog goes, and just what the daily protocol is to reporting those cases.
Okay, Dr. Wooten's coming up.
Thank you.
So the local jurisdictions are not responsible for analyzing the backlog. That is done at the state level because we utilize their case rate, even though we calculate that metric ourselves as a quality assurance measure. We utilize what the state reports. So they have stated that they have gone back and I believe through the 13th and looked at the backlog and reassigned those cases to the respective days, and then the case rates have been recalculated. And that's as much information as I can give you based on the information we've received from having discussions with the state.
And then in the most basic form, Dr. Wooten, can you step us through how, I guess, the positive cases are being counted each day? You've mentioned before that somebody tests positive twice after, maybe testing the week before. It's not counted again as a new case. So I think maybe just clarify for some of the viewers about that.
Sure, thank you. Every day when we report new cases, those are new cases for San Diego County residents only. They do not include suspect cases. They are confirmed, laboratory confirmed new cases. No suspect cases, no probable cases, no individuals on quarantine, no individuals that are not San Diego County residents. The numbers that we give you every day are simply San Diego County residents that have tested positive for the first time, and that's what we report as our daily number of cases. Now, before I give an example about what it would take to come off the list, and People apparently got a bit confused about that. That was cited probably about a month ago when our numbers were 500, 600 plus. It was merely an example of what it would take. And again, since officially as of Saturday, we are off the list because we have seen our numbers, our new cases decline. And that is due in large to all of the great work that everyone, businesses, individuals, have done across the county, particularly as it relates to those measures that I state every day at the end of my update. So that's where we currently are, and we will continue to provide you updates, and we will have more updates for you on Wednesday. Thank you.
Thank you. Thank you, Dr. Wooten.
We have one final call-in question.
That's Paul Sasson with the Union Tribune.
Hello. Thanks for taking my call. Last week, a lot of us asked about this backlog of cases at the state, mostly communicated to the state by the commercial labs, I guess. And when we asked last week, everybody at the county said, yeah, we don't think there are any more backlog cases apportioned to San Diego. We think we've gotten all of those into the system, into our system last weekend. So do you guys have any clarity on where the state found these additional cases, what rock they found them under in terms of assigning them now retroactively, now that it looked like we came off the list? Why didn't we know about these cases last Monday?
Okay, I'm going to ask Dr. Wooten to respond.
Thank you, Paul. We didn't know last Monday, but on last Wednesday, if you go back, I explicitly stated that the state was looking at reallocating outstanding or backlog tests. So on Wednesday, we shared that with you, and we shared that being off the monitoring list would change. So we let you know when we get information from the state. So I can't explain why we didn't know on Monday. That might be a better question posed to the state.
And another question, if you would, regarding testing lag in results. There has been this issue going on for some time now where it has taken maybe a week, maybe 2 weeks, maybe longer for commercial labs to communicate positive test results back to the health department so that they can be reported to the public. What can you tell me about whether that lag time continues? Has it gotten better, or are we still waiting in many cases a week or two to get positive test results back from commercial testing labs?
I am not aware, actually, a week or two, I'm not aware of that lag now. The commercial laboratory turnaround time has improved, and our agency director, there are two people that are coming. Thank you. So, as of, this is the most recent information as of today, August 17th, for commercial labs, it does say average turnaround time is 7 to 10 days. For our state walk-in, Let's Get Checked lab, the average turnaround time is 3 to 4 days. County Helix Lab, 1 to 1.5 days. Our San Diego County Public Health Lab, 1 to 2 days. Family Health Centers of San Diego, 3 to 4 days. And then our hospitals, less than 1 to 1.5 days. So that, as of today, and this is actually for the time period August 9th through August 15th. And obviously, commercial labs have the longest turnaround time.
Dr. Wooten, did you say that lag was 10 days for commercial labs?
7 to 10 days is what's stated here, yes.
And so how do you feel about that? I mean, that's pretty long in terms of informing any kind of epidemiological investigation and chasing down those contacts in terms of preventing the spread, right? What can be done to speed that up?
Well, I can't speak for the commercial labs, but I feel the same way that everyone feels about a lag time of 7 to 10 days. It interferes with the efficiency of conducting our case investigations as well as our contact tracing. So that's the very reason that we worked with the Helix and developed the Helix partnership so we could have increased capacity as well as increased turnaround time for our laboratory tests. So this is not just a San Diego problem, this is a nationwide problem, and our effort is just to develop strategies locally where we are not completely reliant on commercial labs.
So are there some efforts to steer as many tests as possible to Helix since they have such a quick turnaround time? Is there a way to kind of pull back some of the ones that would go otherwise to the commercial labs?
I will have our agency director, who's the lead for our T3 strategy, to ascend to the mic. Thank you.
Thank you, Paul, for the question. I think the reason why the state of California moved away from Quest in early July to Let's Get Test commercial lab was the very reason you're asking. And I think for us locally, our lab testing task force, very vigilant about this issue of the commercial labs. We have reached out to the commercial labs, invited them to participate in our task force. The invitation stands. But I think the commercial labs are working to improve that turnaround time. They are vigilant of the issue. It does not help us, as Dr. Wooten said, if we don't get timely results for our disease investigation and our close contacts, which are responding very quickly, as Supervisor Fletcher pointed, to the time we receive the result, to immediately, within 96% of the time, within 24 hours, responding to that disease investigation. So we're all vigilant about it. Everyone's trying to work on it. I guess it's a moment to say that we're very fortunate in San Diego of having our state testing sites having a relatively good turnaround time, and then our hospitals, our public health lab, our clinic, really hitting the mark for our disease investigation. And I think that's attributed in part to a success in reducing the community spread.
A follow-up there. Do you have a sense of how many, what percentage of tests are still going out to the commercial labs?
I don't with me right now, Paul. I'll get that for you. But I know the bulk of the testing is still hospitals, followed by probably the county with Helix and Family Health Center, and then I'd say the third would be the two commercial labs and a small number of other commercial labs. But I'll make sure I'll follow up and get you that info.
Thank you.
This first text question deals with the county's outreach to COVID positive individuals, and Dr. Wooten's going to respond.
This text question is from Mary Plummer at iNewsSource. She says, some families we've interviewed say the process of caring for loved ones with COVID-19 has been very challenging, given that they don't have medical expertise. They cited unclear instructions from doctors and vague guidance from testing sites, for example. How often is the county reaching out to individuals and families to try and offer them medical advice when a positive case is present?
So before I go into that question, I'd just like to clarify. Last week, our pressers were on Tuesday and Thursday and not Monday and Wednesday. So forgive me for mixing those days up. So now regarding the question about caring for individuals that have COVID-19, if someone has symptoms that are severe, they need to be hospitalized. If people have mild to moderate symptoms, they are asked to quarantine, or rather isolate at home if they have symptoms. They're asked to be in self-isolation at home, and if individuals cannot isolate at home, they have the option of isolating in our public health housing resources. Now, number one, when individuals are positive, they will get an email as well as a phone call from a nurse. And then they will be given instructions, and then there will be a follow-up phone call from the case investigator where they are interviewed for a period of 2 hours to find out who they were exposed to, who their contacts were, and then contacts will get a phone call from contact tracers, which takes about an hour. If individuals need additional information, we ask that they follow up with their healthcare providers. They were given instructions and advised about the isolation order, and they are also given or sent instructions for isolation if they are infected via email. So that is the current process that is in place. Again, if individuals have additional questions, they should always loop back to their healthcare provider.
And I have a second text question. This is from John Fox Res, Radio 91.3. What other steps do schools need to take towards reopening once the 14 days below the threshold of 100 cases per 100,000 residents have been completed?
Thank you for that question. Our schools are fully aware that whenever the opening date, and right now we've calculated that as of the day after August 31st, if we continue to trend below 100 cases per 100,000 population, the schools would need to have a safe reopening plan that they would post on their website and in locations where parents and faculty and the general public can view that document. And there has been a lot of effort that has gone into effect with county staff working with staff from the San Diego County Office of Ed and others and our sector groups to inform institutions regarding what should be included in a safe reopening plan.
And excuse me, but I have a follow-up question from Mary Plummer at iNewsSource. Does each positive case get a call from a county nurse? Trying to understand the medical care follow-up from the county.
Thank you for the opportunity to clarify again. Each individual that tests positive will receive an email and a phone call. Individuals that test negative get an email stating that they are negative. After there's that initial phone call informing the individual that they are positive, they will get a follow-up phone call from a case investigator. So the positive tests are then determined to be cases or not. They get a phone call from a case investigator. That phone call and conversation takes about 2 hours to gather information about where they've been, who they've been in contact with, so that we can better conduct contact tracing to know who their close contacts are and what other entities need to be investigated so that we can decrease the spread and quarantine those individuals that might have been exposed to these positive cases.
Thank you, Dr. Wooten.
Well, that completes our questions for today. Just one quick update. As we mentioned last week, the border test site has increased its hours of operation. It's now open from 6:30 a.m. to 12 noon, and we can accommodate up to 200 tests per day. That's one of 3 testing sites that we have where you do not need an appointment. The other 2 being the Tubman Chavez Center and the California State University in San Marcos. We're going to stick to our regular schedule this week, so our next scheduled media briefing will be at 2:30 on Wednesday. And again, let's keep the momentum going. We've got, I think, a lot of good results from people complying with the public health directives. We hope everybody will continue to do that. And again, please stay safe, San Diego. We'll see you back here on Wednesday at 2:30.